Dr. Shanu Modi, thank you for talking to us here at ESMO.
My pleasure.
Shana, you're a medical oncologist at Memorial Sloan Kettering Cancer Center with a clinical practice that is devoted solely to the care for cancer patients with breast cancer.
Right. Yes.
But also you are have important research activities focusing on clinical development of new therapies of the treatment of breast cancer with a particular emphasis on evaluating targeted biological anti-cancer agents. So today we are going to talk about one very interesting study which you presented at ASCO, but you went into more details in here at ESMO. That's the Destiny Breast 04 trial with trastuzumab deruxtecan, DXD. Can you tell us a little bit what were the main findings in this, I would say, groundbreaking trial?
Yes, no, thank you. So, the Destiny 4 was a really important study for the field. I mean, we've long known that there are tumors that have low levels of HER2 expression, and in the past, none of our HER2-targeted therapies, the currently available therapies, have had an impact or benefit for those patients. So a bit of a frustration to not have targeted treatment for that group of patients. So TDXD is the first HER2-targeted therapy that has shown really striking efficacy, even in cancers where there's low levels of HER2. And so the Destiny 4 trial was a real a step forward to challenge our standard of care versus TDXD for these patients with HER2-low breast cancer. And so it enrolled patients who had already received prior lines of therapy. On average, they had 3. And they were randomized to either TDXD or standard chemotherapy. And what we found was that TDXD reduced the risk of cancer progression by 50% compared to standard treatment. So, for example, the chemotherapy group of patients had disease control for 5 months, but if they were on TDXD, that control went to 10 months. And similarly, there was an impact on overall survival. So we saw a prolongation of survival in the group of patients who got TDXD. So, and to put that in context, I mean, in the late stage metastatic breast cancer setting, we often don't see survival advantage with the new therapies we introduce. It's often a quality of life improvement. So the 6-month survival advantage that we're seeing with TDXD is actually really, really important. And one can hope that we can, as we move this drug into less pre-treated settings, that we may have even a greater impact on survival.
So the study obviously shows that HER2 low is a targetable population for this drug.
Right.
Yeah.
Yes, I think that's one of the things that's groundbreaking also about Destiny 4 is it, for the first time, is showing us that we can target patients whose tumors have HER2-low breast cancer.
And you were talking about moving into early lines of treatment with the TDXD. What are your hypotheses with the progression-free survival and OS data which will come out of these kind of studies?
Right. Yeah, I mean, there's been so much interest in that, and we already have some trials underway. The Destiny 6 trial, which is in many ways is similar to Destiny 4, except these are less pre-treated. So these are patients who have not had any prior chemotherapy. I mean, I think we know clinically there are patients who have very sensitive tumors to endocrine treatment who can do well with endocrine therapies for a long time. But there is a group of patients, even in spite of having endocrine or the hormone receptor status on their tumors, they are less sensitive to, those cancers are less sensitive to endocrine therapy, and even some of our best combinations with CDK4/6 inhibitors don't seem to work well in those cases. And I can imagine that, in those kinds of populations where we have very aggressive refractory disease, that drugs like TDXD are going to have a real impact. Fundamentally, we're taking, high doses of very potent chemotherapy directly to those cancer cells, and it works well.
You have a clinical practice, which I mentioned earlier.
Yeah.
Have you used TDXD for this indication with your patients in your clinic?
I have we have a lot of experience now. We're fortunate that TDXD was available in the U.S. since 2019, since the end of 2019, for the HER2 positive population.
Yeah.
So we've been using it, I think, since that time, and most of us have been very, I think, comfortable with learning how to manage it. And now we have the opportunity to, expand to a new population, and most of us have been very eager to do that. And in fact, the regulatory authorities moved very quickly with the release of the Destiny-4 data. So now we have access to this drug for our HER2 low population. It's been incorporated into our guidelines. So I think we're starting to see a lot more patients have access to it, and we are starting to use it in this setting, yes.
I saw you on ASCO. You presented in June. In August, FDA approved it.
Yeah,
that's awesome. That's very fast-moving. Whilst EMA here in Europe has, can we say, dragging their feet a little bit. So I think there's anticipation also here in Europe for this. Yeah.
Yes. Yeah. Well, we're hoping that these kinds of life-changing therapies should get to everybody. We have to think globally about things like this. So I hope that this is a motivation for other regulatory authorities to get on board.
ADCs are a very interesting new drug type, and you mentioned in your presentation in a lecture here at ESMO that there of course are other ADCs that is currently available and are coming up in exciting studies.
Right. Yeah, I mean, I think we're really in a new era of ADC therapies. It's very exciting. The technology has really evolved. And look, even the Destiny-4 data, they're more than just about breast cancer, and they're more than just about TDXD. They're really about progress in cancer therapeutics, and I think ADCs are really at the forefront of that. So there are a number of new generation ADCs coming down the pipeline. So lots of things to keep on the radar. One of the happy problems we're going to have is figuring out how to sequence these so we can get the maximum out of each therapy. So we do need to do still a lot more work in developing, I think, more predictive biomarkers and understanding resistance, so that we can rationally select through amongst all of these treatments.
Currently, you are conducting a study, Destiny Breast 06. You said on your presentation that is exploring the TDXD on patients with HER2 ultra low expression. Can you tell us lastly about this
Sure.
study?
I mean, we're always learning, and one of the things that we have learned is that TDXD is active even in tumors where the IHC HER2 score is 0. A very, very provocative trial called DAISY, which is really a translational study to try and understand mechanisms of TDXD, uncovered a response rate of 30%, really surprising.
Yeah.
But I think the key learning here is that there is HER2 present even in IHC 0 cancers. So the question is really, what is the lower boundary of HER2 low? It's clearly not 1+. I mean, in Destiny-4, we saw 1+, 2+ have the same benefit. And so there must be a lower boundary, and I think it's important that we uncover that. So trials like Destiny-6 are including population of patients that have this ultra HER2 low, which means the tumors have more than 0, but less than 1+. So that slot right where there is some expression of the protein, and we're going to uncover whether this drug is as active in those patients as the 1+. So hoping to fine-tune that lower boundary.
When do you think this study will be published?
I think it's enrolling very briskly. But I expect it's still 1 or 2 years away from hearing some data.
Very exciting. Shanu Modi, thank you for sharing your knowledge and insights with our audience. Thank you.
My pleasure.
Thank
Thank
you.
you.